So every returning traveler that's coming back to KFL&A is being asked from the time of their arrival to stay home for full 14 days. The reason we ask 14 days is because if they had been infected with COVID-19 during their holidays, on average it would show up sometime within 5 to 7 days, so sometime in this period. But it could come as short as 2 or as long as 14 days. So if a person returns and does not have symptoms, that's a really good sign. They should certainly continue to monitor after the 14 days, but after this 14 days they can go back into the community and just practice social distancing. If they do develop symptoms though of a fever and or a cough and or difficulty breathing, they should go to our assessment center, either at Lennox and Addington Community General Hospital or the Memorial Arena. They should get assessed, possibly tested, and then, because they've developed symptoms, have to be off for 14 days from the start of their symptoms. All of this will limit the spread in our community and prevent others from being infected. And 14 days, we know from the current science in Wuhan and in other jurisdictions that the people have less and less virus, and by 14 days they'll have very, very little, if any, viral shedding, and hence can go back out to the public. We'll consider after 14 days that they've recovered. We may test you if you're a healthcare worker at this point to ensure that you're no longer at risk. But that's, again, another 14-day period. So if a returning traveler, sadly, got sick on day 13, they might have to be off for 4 full weeks until they recover. And if you ever get sick during this 14 days, again, you could go back to the memorial site if you're stable and get reassessed. And they'll check your blood pressure, your heart rate, and your oxygenation. If you didn't isolate yourself appropriately when you were a returning traveler, we would ask all of your contacts and ensure that all of your contacts are off for 14 days as well. And that's important just from this principle that this person could spread the infection to others, and during that 14 days of the incubation period they could develop symptoms. And the contacts would then, if they develop symptoms on day 13, have to be off for another 2 weeks. So this is the science behind why we're asking 2 weeks and why it's so important that any returning traveler isolate themselves from others. That's no contact with others. They should be staying home for the most part. They should be asking someone else to go get their food or any other interaction into the community. And taking the basic principles of hygiene at home, frequent hand washing. They certainly can go in their backyards, they can go on their properties, and we're asking otherwise that they stay at their homes and socially isolate themselves so that they don't have the risk of infecting others. This is the only means by which we have a way to control this infection from coming into our community. I'm very confident we're good now, and it really depends on every returning traveler to play their part and to protect the rest of us that haven't been exposed to this virus yet.